Hello and welcome to this edition of Successful Physicians Monthly. I'm your host, Marr Brown. Today I am very excited to be speaking with Dr. Dan Anderson, President and CEO of the Riverside Community Health Foundation. Dr. Anderson earned a Doctor of Ministry degree from Fuller Theological Seminary, and he earned both a Master of Divinity and a Master of Education degree from Talbot Theological Seminary. Dr. Anderson has 40 years of experience working in the nonprofit sector. For the last 15 years, he has advocated for the healthcare access for the low-income and uninsured populations of Riverside through his work with the Riverside Community Health Foundation, a nonprofit public charity. Dr. Anderson has been a central figure in guiding the Riverside Community Health Foundation into one of the leading providers of access to health care for the uninsured and health education and prevention services in the Inland Empire. Dr. Anderson, thanks for being with us today.
Oh, thank you very much for having me.
You're welcome, you're welcome. So can you tell us a little bit about your professional background?
Yes, my professional background. Actually, my journey started with more of a spiritual path in my life, in the sense that I really wanted to help people and be able to reach out to them. And so I went more in the direction of theological caring in that aspect, and ended up being a hospital chaplain.
Okay.
Worked with hospice for many years, and probably gave me some of the training that I'm using today. Right. As head of Riverside Community Health Foundation. And where I'm at now is being able to really manage community clinics and programs and granting and staff to really reach out to the underserved community. And so where I am today is very different than where I started, when I thought one day I was going to be a social worker. You know, ended up down this spiritual journey, and then here I am today running an organization that's making a big impact in the Riverside community.
Well, in doing my research on the Riverside Community Health Foundation, you know, I looked at the vision and the mission, and there's such a strong push towards really the community and helping patients and truly applying the care part of healthcare. And to hear your background, sounds like that's been a pretty good relationship between yourself being the president and CEO and the foundation. Can you talk to that a little bit?
Yeah, one of the things that intrigued me in the hospital was you had to be a go-between the physician and the patient, because doctors didn't always know how to really communicate to their patient, especially if somebody was actively dying or going to die. Mm-hmm. They knew medicine, they knew healing, they knew how to take care of somebody in these steps, but they didn't know how to talk to a family at the time that was most crucial in the loss of a loved one. And I saw that connection, being an advocate for the patient, to be able to stand there side by side with them and ask questions to the doctor and bring a comfort level. That inspired me, because my role today is I'm an advocate for patients or people in the community. Okay. To advocate for their health, to make sure that they have access to health care. Right. And so there was a real connectiveness to what I saw in one place, and then the mandate to do what we're doing in the community. I kind of carry that philosophy across the table.
Well, let's talk about that a little bit. What programs have you implemented, or are you focused on, that really kind of marry the relationship between the physicians, taking care of patients from a medical perspective, but also from a personal perspective in terms of really helping patients get through certain medical situations that they're faced with?
Well, I think today, I mean, it's different, but when we were able to look at the community and say, what do we want to do? We knew that we wanted to connect with people. And we took the target of more the underserved and the uninsured, because they're the ones having the most difficulty finding a place to see a physician access, because they didn't have the financial resources. So I think that drove us to provide a safety net of services, such as community clinics. Okay. And out of the community clinics, we learned, wow, dental's an issue. So school personnel is telling us, wow, you know, we can get the screening for our children, we have no place to send them. So that opened another door to, we need to provide dental. Okay. And with that, we then looked into, well, can we bring more screenings? Can we do some preventative work? And so we brought sealants to elementary schools. Out of that came the discussion, well, they have problems with vision. They lose their glasses. Can you replace them? And that opened another door. And so the whole perspective of looking at the community began to open up these gateways of services. And so when you ask about the physician to the patient connection, we have exercise classes, nutrition, cooking classes, places where they can get preventative or education or knowledge to be empowered as a patient as well as a person in the community, how to better their lifestyle.
How important is prevention, and how big is that for the foundation?
I think it's huge. One of the mandates for us was to go out and make community projects based on our understanding that people had a hard time. Our system drove us to more of a medical model, meaning when you're sick, now show up. Okay. And in between, there was nothing going on. It was, okay, next time I'm going to see the physician. And it could be 2 years, 3 years. In the meantime, families that let it go, or an individual lets it go, has a stroke. And it was very preventable by basic eating, walking, exercising, and having a physical check every year, an annual physical checkup with a doctor. And we figured if we could just give them that knowledge and then provide places, because they couldn't afford maybe necessarily a gym membership, right. But they could enter a community center and join a Zumba class and exercise. Right. In the process of learning the exercise, they're also giving information on nutrition, how to eat better. And then, oh, by the way, there's a cooking class that demonstrates some of what to cook. And here's some recipes. And if you go to the store, here's some of the things to buy. So there's a whole connectiveness of behavioral change that we're trying to get out there to the individual that doesn't have access to their physician. Matter of fact, in many cases, they're scrambling to find a location, someone that'll be able to take them in a sliding fee type scale. And so our role was, how do we get out there, how do we get in front of this and begin to give knowledge to community members? And one such example was when we opened our Arlanza Health Center, the Arlanza Family Health Center. When we opened that clinic, we looked at the community and said, how can we engage a community that probably has 90% Hispanic population? And language is a barrier, transportation's a barrier, trust is a barrier, and they're used to going to Mexico for care. So we looked at starting a women's active community group and invited community women in to start meeting and talking about what are the services they want to see at the clinic. Okay. What do they see as the health needs for them? Right. And then in turn, what we did from there is we designed a program to hire 4 of the women from the community called promotores, our community health workers, and they then engaged in the community with these other women and other families. We trained them, gave them some health knowledge, basic health knowledge, an understanding of the process, and then we turned them loose to go see the community, be out in the community. So they do exercise classes, they'll do Tai Chi, they'll do Zumba, they'll do the cooking classes, and they're a trusted face. They're a trusted entity in the community, and people look to them. Where do I need to go? What questions do I need to ask? How do I get these resources? And they're very much a resource, and that's an example of reaching out to our communities and getting prevention there.
I think, we were talking a couple weeks ago, we were having a discussion, and I believe you had mentioned that sometimes there's a need for a better understanding of the foundation in terms of not so much the community, but the different physicians in the area. Yeah. Can you speak to that a little bit, and what can you share to help build a better understanding of the value? I mean, obviously there's a clear value, but of the programs and the ways to access, what the foundation has to offer, so that the physicians in the community can take advantage of.
Right. I think it sometimes gets forgotten that a foundation like ours, embedded in the community, brings a lot of resources. We're able to grant other nonprofits. We've been able to align with physicians. If somebody is seeing somebody in their office and they live in one of our zip codes that we have programs, if they don't have anything, they can actually send them home and they can go to one of the programs. So I think that's a benefit to a physician, to be able to say, by the way, I know that these community resources exist in your zip code, and there's a Zumba class. Rather than running, maybe you should go to the Zumba class. We have diabetes, there's a mapping class just around the corner from you. And so those are benefits to physicians, especially if they have a lower income individual coming through their doors and resources are lacking there. The other thing I think physicians probably don't know is our foundation grants. And one of the things that we granted in Riverside area was to insure the uninsured children. Okay. And so we have money going out that insures 500 children. Now, mind you, it's 500. We wish it was more.
Right.
But they have full insurance, and they're able to come through the doors of those hospitals. And those hospitals don't lose any money.
That's great.
They get reimbursed. That's a plus. And so looking at our foundation, we're able to put $2.2 million worth of grants in the community every year around health care, and more around the preventative idea that keeps individuals from just using the ER and taking up, precious financial resources. They're seeing their care somewhere else and only using that as an emergency, which is the goal
What it's
of an
designed for.
emergency
Right.
room. So, those things are taking place. That should be a benefit to the healthcare organizations as well. And so the things that we also do is we partner with physicians, and they do actually some of our classes.
Okay.
So they'll come in and do seminars. We do seminars at Parkview Hospital and Riverside Community Hospital, and physicians come in and present. And they have the opportunity to not only present, but also to gain other patients that might, hey, by the way, I loved what you're doing, and
Right.
I'd like to, have you as my doctor.
Right,
And
right.
so I think that's a positive, and I think it gets overlooked because physicians sometimes see the hospital or medicine as the only way of dealing with things.
Your foundation is doing so many really good things for the community and for the doctors and the patients. My question is 5-10 years from now, in terms of your vision, for the Riverside Community Health Foundation and how you would define success. I mean, it's working really well right now, but what more do you think can happen? What more can be done, and what would you like to see it become, 5-10 years from now?
Yeah, success is hard to measure sometimes. I think what I would look at is, I'm hoping as an organization we're still looked at as an organization of integrity, who is constantly building new programs, strengthening their programs, and reaching out. I think indicators of success would be more people in the community are exercising. More families are asking the right questions of their physicians. They're understanding how to maneuver the health system to take care of themselves. They're talking about a message of where we need to eat, how we need to eat, and how their lifestyles changed from that. I would see our encounters, we do just over 100,000 encounters a year. I would see that doubling, if not tripling, over the next 10, 15 years. I would see an expansion, at least, of the East Side Health Center. I know we're already moving that direction to try to add more services. I'd like to see us a little bit stronger in supporting the community around behavioral health, because I think that's the next avenue that we really need to put resources in, and I think that's a big concern. So I would like to see the organization reaching out in that way, in reaching the milestones, as well as the endowment's grown. There's more dollars to do more. That's out of good management, being good stewards. And with that, we continue really doing what we said we would do, and that is partner. That people would still say they're the ones that go out and partner, and that we would hear that still the next 10 years.
Dr. Anderson, I mean, it's clear to me that you've built a tremendous foundation, and earlier you said that one of the measures of if it's working or not is people walking in twos and threes and hand in hand and reaching out to the community and getting the community involved in prevention and working with children as young as kindergarten and preschool. I think that's excellent, and I think that we've spent some time today really addressing the true benefits of the Riverside Community Health Foundation, and with you at the helm, I see nothing but success and good things happening in the future. So I want to really thank you for your time today.
Thank you very much.
And I appreciate it.
All right, thank you.
Thank you very much. The Riverside Community Health Foundation encourages physicians to use its free preventative health education classes as a resource for their patients. You can visit the Riverside Community Health Foundation website at rchf.org to find out more about the programs and services they offer. Or call 951-788-3471 for more information. I'm Marr Brown, and I want to thank you for watching this edition of Successful Physicians Monthly.